Good morning everyone. I am Dr. Kailash Patil. I am a consultant knee surgeon at Sancheti Hospital, Pune. I am specializing in arthroplasty, that is joint replacement surgeries, and sports injuries, that is arthroscopy or telescopic surgeries, which we do in patients who require ligament reconstruction surgeries or meniscus reconstruction surgeries, that is the soft tissue surgeries around the knee joint in patients who are involved into sports injuries. Now sports injuries involve a plethora of injuries such as anterior cruciate ligament injuries, posterior cruciate ligament injuries, medial lateral collateral injuries, meniscal injuries or cartilage damages. So all these injuries are in fact sports injuries. So these sports injuries can very well be treated. There was a time initially when these injuries had to be treated with open surgeries in the form of opening up the knee and doing the surgeries, but nowadays we can do all of these surgeries arthroscopically, except a few surgeries which require a little bit of opening of the knee, but not as much as it was in the earlier period. So ACL injuries are the most commonest injuries. So most of the patients which I get, in about 70% of the cases, they are going to be ACL injuries. Say about 20% is going to be ACL with meniscal injuries, and 10% is going to be posterior cruciate ligament injuries. So these injuries are divided upon how complex these are and how we are going to get as anatomical or as natural to the individual's anatomy as it is going to be. So now with newer methods, with newer machines, with newer scopes, the instruments which we use for doing these surgeries, we are getting more precise results with ACL reconstruction surgeries, PCL reconstruction surgeries and meniscus repairs. So in case of ACL injuries, it is one of the most important ligament of the knee which helps in stabilizing the knee in the antero-posterior or front to back movement and the rotational movement or the turning movement of the knee. So that is more important for ACL, which is the commonest injury. For the PCL, the ligament which is at the back, that is also helpful in antero-posterior and rotational injuries. So these two ligaments are like a hinge of the knee. So in cases of ACL injuries, we do something called as a hamstring or a semity graft, where we take one portion of your body's graft or a tendon from an extra tendon from your body, and we put it across and build up the ACL. Similarly, in cases of PCL injuries, we do the same thing, but exactly the opposite of what ACL is going to be. Your ACL is the ligament in the front, your PCL is the ligament at the back. So this involves an arthroscopic surgery. Most of the times in high level athletes who are high demand, who are going into sports and they really don't want to miss out on the season, what we use is what is called as a BTP graft or a bone tendon bone graft, where the bone is part of a bone is taken out along with the tendon so that it heals, because whenever we put these ligaments across the bones, we are going to hook it or hinge it to the bone itself. So if it's a soft tissue which is hinging to the bone, it takes a little longer to heal, whereas if we are going to put a bone across, it takes a little lesser time to heal because it's bone to bone healing. So in cases of high level athletes or athletes who are going into sports very fast, we use the BTP graft, that is a bone tendon bone graft, for ACL or PCL reconstruction. Other than that, what we use in clipping or using the graft to fix it to the bone, either we use something called as an all inside technique, where we use a clip on both the sides where there is not too much of opening of the knee and the graft is hinged in between, or we use something called as a bioscrew. Bioscrew is a material which is made up of certain material which is called as a HA, which we usually use, hydroxyapatite, which we usually use to fix that graft to the bone itself. And these, over a period of time, say 3 to 5 years, these screws which we put inside the bone, they get dissolved over a period of time. So that is one of the technique, but it depends on what is the length of the graft, how strong a fixation we are going to get, and what the demand of the patient is. So all these things help in building up an ACL or a PCL reconstruction. Coming to the meniscus part of the knee, the meniscus is the cushion in between the knee. There are two of them, one on the outside, one on the inside. So both of these menisci are very important in three things. One is distribution of the fluid inside the knee. Second is shock absorption of the knee and the stability of the knee. So these three things are handled along with the ACL and PCL by these menisci. So most of the time in younger patients, if it's an acute tear, we prefer to suture it or put it back in its place how it was anatomically, how it was God given. in most of the cases where it lies in the red zone or the vascular zone of the meniscus, the repairs are going to be much more easier. Whereas in cases where it is going to be in white zone, we preferably not repair it because the healing is an issue. Now coming to the ligaments on the sides, they are called as the MCL and the LCL. That is the ligament on the inside and the ligament on the outside. So this is the collateral ligaments or the ligaments at the sides. So these are also prone to now, because most of the patients are going into active sports or competitive sports, the injuries on these collaterals are also increasing day by day as we see these patients. Now these patients, usually we do an open repair if it's an acute tear, if it's an immediate injury where the patient falls and comes to us. But if it is a old tear, if the patient does not bother to take care of it, we have to do a reconstruction procedure, which is an open procedure. So it's similar to your ACL, only thing is that it is an open procedure, it's not an arthroscopic procedure. Now coming to the other part, what if I injure my ACL or PCL again after I do a reconstruction? So in these cases, we do something called as a reconstruction or revision reconstruction surgery, where we can do it at one time or we can do it staged. That is, one time we just put in a graft in the holes which we have made for the earlier ACL and then wait for it to heal and do the second time the ligament surgery, or we can do it at the same sitting if your tunnels or the holes which you have made in the bones are not going to be anatomical, we can put them into anatomical portion. So this is how we go about ligament injuries. This is very short about ligament injuries, but I would definitely be happy to share more details of each and every ligament at some time next in my next video. I thank you all for patient listening. Thank you very much.